Here are MCQs from sedative hypnotic drugs. These MCQs will help you to evaluate your knowledge and to prepare you for the assessment of this topic. The first question is, the quality of sleep corresponds to the duration of N1 to N3 stages of sleep, N3 and RAM phase, N3 stage only, or RAM phase only. And the correct option is N3 stage and RAM phase of sleep. This is because quality of sleep improves with increased duration of stage N3 and RAM phase of sleep, because in these stages, restoration of body and mind takes place. The second question is, while we are sleeping, the consolidation of learning and memory takes place during. The options are N2 stage of sleep, N3 stage of sleep, RAM phase, or all of the above. And the correct option is RAM phase, because RAM phase of sleep is involved in restoration of mind, consolidation of memories, and new tasks takes place during this phase. The next question is, the part of brain involved in maintaining circadian rhythm of sleep wakefulness cycle is, and the options are frontal cortex, pineal gland, reticular formation, or suprachiasmatic nucleus. The correct option is suprachiasmatic nucleus, because suprachiasmatic nucleus of the anterior hypothalamus acts as internal clock or pacemaker to maintain circadian rhythm of sleep. The fourth question is, all of the following drugs produce their hypnotic effect through GABA A receptors except. The options are phenobarbital, alprazolam, isopicolone, or ramelteone. And the correct option is ramelteone, because rest of the three drugs produce their effect by facilitating the action of GABA on GABA A receptors, whereas ramelteone is an agonist at melatonin receptors. The next question is, all of the following receptors are targets of the sleep inducing drugs in clinical use except GABA A receptors, glycine receptors, MT1 and MT2 receptors, or orexin receptors. The correct option is glycine receptors. Actually, none of the available sedative hypnotic agents work through the glycine receptors. The available therapeutic agents for sleep disorders and anxiety are working through rest of the receptors. Question 6 is, all of the following statements are true regarding mechanism of action of benzodiazepines except. The options are benzodiazepines bind at alpha gamma interface of GABA A receptors. B. Benzodiazepines exhibit direct stimulating effect on GABA A receptors. C. Benzodiazepines facilitate GABA action on GABA A receptors. And the D is Benzodiazepines increase the frequency of GABA A associated chloride channel opening. The correct option is benzodiazepines exhibit direct stimulating effect on GABA A receptors. This is the only mechanism among the four options which benzodiazepines are devoid of. Benzodiazepines do not exhibit GABA mimetic effect. The next question is, an overdose of diazepam is accidentally consumed by a 5-year-old child. The best antidote treatment that may be given to him is A. Flumazenil, B. Nalorphine, C. Naloxone, or D. Naltrexone. The correct choice is flumazenil, because flumazenil is a competitive antagonist of benzodiazepines at GABA A receptors and rapidly reverses the action of benzodiazepines. The eighth question is, in addition to benzodiazepines, flumazenil also blocks the actions of, the choices are barbiturates, lemborexant, ramelteone, or Z drugs. And the correct option is Z drugs, because besides benzodiazepines, flumazenil is also a competitive inhibitor of Z drugs. The next question is about a 21-year-old man who is a full-time college student and also works 25 hours per week. Over the past 3 months, he has become increasingly anxious. He says he is tired most of the time and has trouble concentrating on his studies. Which of the following drugs would be the most appropriate initial pharmacologic treatment for his anxiety? Alprazolam, phenobarbital, propranolol, or zolpidem? The correct option in this case is alprazolam. This is because barbiturates, due to their marked sedative effect at anxiolytic doses, are no longer recommended as anxiolytics. Zolpidem possesses hypnotic effect only, therefore it cannot be used, and similarly propranolol is effective more against the forms of anxiety that are manifested mainly as physical symptoms. For example, sweating, tremors, and tachycardia. Therefore, among the drugs mentioned here, alprazolam is most effective and recommended drug in this case. This question is about a 38-year-old woman who is presented to a clinic with complaints of difficulty falling asleep. She reports that despite the tiredness, it usually takes her 2 or more hours to fall asleep at night. Which of the following drugs would help relieve her sleep disturbance while being least disruptive to REM sleep? The options are hydroxyzine, phenobarbital, triazolam, or zolpidem. And the correct option is zolpidem, because among these drugs, zolpidem, which is one of the Z drugs, it decreases sleep onset time but has minimal effect on REM sleep. The 11th question is, the benzodiazepine drug most likely to cause day after hangover effect is temazepam, triazolam, alprazolam, or flurazepam? The correct option is flurazepam, because flurazepam, due to its extended half-life, may cause excessive daytime sedation. The next question is, which of these drugs can be given at bedtime or later during the night if a person is unable to sleep and has only 4 hours left to sleep? The options are diazepam, temazepam, zaleplon, or zolpidem. And the correct choice is zolpidem. And this is because zolpidem is the best choice in this case, as it is effective in sleep onset insomnia but does not prolong sleep time. The 13th question is, a drug that can effectively relieve anxiety without causing any significant sedation and impairment of psychomotor functions is alprazolam, buspirone, lorazepam, or phenobarbital. And the correct choice is buspirone, because buspirone is a selective anxiolytic drug and does not cause marked sedation and hypnotic effect. It also causes less psychomotor impairment and does not affect driving skills. When used as a hypnotic, the day after hangover effect among the following benzodiazepines is minimum with diazepam, nitrazepam, alprazolam, or triazolam. The correct option is triazolam, because due to its shorter duration of action, the day after somnolence is minimum with triazolam. At therapeutic doses for the anxiolytic effect, the highest psychomotor and cognitive impairment is observed with alprazolam, buspirone, phenobarbital, or diazepam. The correct choice is phenobarbital, because at therapeutic doses for anxiety, barbiturates also cause to some depressant effect on psychomotor and cognitive functions. The last question is, a patient with chronic obstructive pulmonary disease needs medicine for insomnia. The safest drug to be used for the management of insomnia in this case is temazepam, triazolam, zolpidem, or ramelteon. And the correct option is ramelteon, because benzodiazepines and Z drugs are associated with some risk of respiratory depression, especially in patients with pulmonary disorders, whereas ramelteon has not been shown to cause respiratory depression.